You have 5 seconds to finish the conversation with your neighbor. Perfect. Well, hello, everyone, and welcome to our 4th Death by Design Friday session. Raise your hand if you have been at all Friday sessions so far. Wow, that is amazing. Raise your hand if you've been to all of the Friday sessions and all of the Wednesday supplemental sessions. Okay, fewer. Those are what we'll call our diehards. I just thought of that on the spot. Pretty good, huh? Thank you. Well, I so appreciate all of you being here today. It's going to be a great session. A couple of housekeeping items first. We know that it is a little chilly in here. We've made the appropriate phone calls, and hopefully in no time you'll be sweating. But thank you for bearing with us. There is a question on your survey, on your evaluation, about room temperature. So feel free to make your voice heard. All right, so on Wednesday, 2 days ago, we put out the sign-up sheets for the upcoming supplemental sessions. And we still have space on both of those sign-up sheets. This coming Wednesday is going to be the Death Cafe, and we have about 5 remaining spots to sign up. You may be waiting to sign up because you're thinking, what the heck is a Death Cafe? So this is actually an international movement, Death Cafe, and its aim is to make a somewhat potentially uncomfortable topic feel more accessible in a cozier and more comfortable environment. So it's open conversation around topics related to death and dying, and there will be drinks and pastries. What more could you want? It's hosted by a certified death doula. You may know of a birth doula. We also have death doulas. Dana Brinson is a local certified death doula, and we have hired her to come do this Death Cafe. So she is an incredible professional, and we have about 5 slots left. The sign-up sheet for that is at the Life Enrichment Board. So that is the Death Cafe. We have a wait list as well. If the sign-up sheet fills up, but you're interested, sign your name on the wait list, and we can potentially have her come back if there's a lot of interest. So that's the Death Cafe. Then the supplemental session on Wednesday, the 19th, is legacy letters. We have the sign-up sheet out for that as well, and we have about 15 or 20 spots left. We highly encourage you to sign up for this really great experience hosted by Crowsdale resident Jane Hoover. A legacy letter, you may remember Kim, our Oscar award-winning actress, receiving a legacy letter in the video last week, but it's a document that you write about your values, experiences, life lessons. It can express hopes, blessings, explanations, forgiveness, apologies, gratitude. A legacy letter is written from the heart to share memories, family stories, and life lessons with family members, friends, and future generations. So it's a gift of love, and I really think you'll enjoy that session. So those are the reminders that both of those final supplemental sessions require sign up, and those sheets can be found at the Life Enrichment counter. But without further ado, I know you don't want to hear me talk anymore, so let me introduce today's guest speakers. As modern technology prolongs our lives, a life well lived can often end with a long and painful struggle. A lot of us have probably witnessed that, right? Increasingly, there are choices available about end-of-life options that afford greater personal control over the time and manner of death. A good death is more likely when the dying person, medical practitioners, and those supporting the dying person are more informed about what some of those options may be. That brings us to today, and to these folks up here with me. We are thrilled to welcome Elliot and Susan Schaefer for a discussion of the medical, ethical, and legal issues involving VSED, VSED, voluntarily stopping of eating and drinking. It's a somewhat little known end-of-life option. Who here, raise your hand if you had heard of VSED before today? Okay, well today you're going to learn a lot more. They will share with us the end-of-life story of Susan's mother, Beatrice, a resident of a retirement community in New Jersey. Elliot Schaefer is a retired geriatrician who was formerly the medical director at Martin's Run Life Care Community, and Susan is a retired attorney who was formerly senior counsel at AstraZeneca, a pharmaceutical company. So if you're not already impressed, I mean, come on, these are some experts. They've lived here in Durham for 12 years, currently downtown, and give this talk throughout the Triangle. We are so lucky to have them here at Crowsdale today. So please put your hands together to warmly welcome the Schaefers. I've turned them both on.
Good afternoon. We're so pleased to be here this afternoon. That way? Before we begin, I'd like to ask you to hold your questions until the end when there'll be plenty of time for questions. VSED, which is often pronounced VSED, stands for Voluntary Stopping of Eating and Drinking. It is one of several end-of-life choices for a competent person with a terminal illness. In 2009, my mother was diagnosed with oral cancer. She received a painful course of radiation and chemotherapy. The treatment was unfortunately unsuccessful, and she was faced with the final and very painful stages of her disease. I wrote an article about her end-of-life decision that was published in the Philadelphia Inquirer, and I would like to read a portion of it to you today. After Labor Day, we learned that the treatment had not worked. The cancer had spread, and Mom's life expectancy was now measured in months. It was the only time throughout the ordeal that I saw Mom cry. She told me she was not afraid to die, but she was afraid of the pain and suffering to come in the final stages of her disease. She wanted to be in control of her life and was thinking about whether she could just stop eating, but feared that would be just as painful. I felt torn, wanting to hang on to every remaining minute of her time with us, but understanding her dilemma. I suggested that she discuss her options with my husband, Elliot, a family doctor and geriatrician. Mom and Elliot had a long talk, and Elliot shared information with her about people who forgo food and water, that not only do they not experience increased pain or hunger, but in fact, generally those people enjoy a peaceful death with little or no suffering. Mom decided that this was the course she wanted to take, but she was not ready to stop taking nourishment just yet. Once Mom's closest friends and family heard about her prognosis, they all arranged to visit her. She quietly and individually met with her brother and each of her 6 grandchildren. She smiled as her great-grandsons rolled around on her bed. The morning after saying her final goodbyes to her loved ones, Mom quietly informed us that she was ready to stop eating and drinking. Her choice itself was not a surprise. We were expecting it, but the timing was a shock. We quickly arranged for one of us or an aide to be with her at all times, expecting her strength to fail precipitously. Each morning, I would approach her apartment with trepidation, wondering how much closer to death Mom had traveled overnight. Amazingly, I found each day Mom's spirits grew lighter and more peaceful. There was an immediate and dramatic change the day after Mom made her choice. It was as if she realized that she no longer had to struggle, that she had taken control, and she found comfort in that. The stream of friends and family continued, and Mom would doze lightly between visits. She was always cheerful during these visits, nostalgic about her life and relationships, and open to discuss her decision, which almost everyone found somewhat shocking. At the end of the first week, Mom was so comfortable that she wondered, when is something going to happen? We assured her that generally it takes no more than 2 weeks for a body to slip away without food and water. Mom continued to deny any hunger. She did express appreciation for the few sips of water that she took with her pain medication, and we soothed her dry mouth with a spray that helped replace saliva, and that seemed to satisfy her. At no time in the days that passed did Mom appear to be suffering. She lived those last days with a tremendous grace that touched everyone who was privileged to spend time with her. We talked about death. She was clearly not afraid of dying. She frequently smiled and acknowledged what a good life she had lived. Mom expressed curiosity about what she would experience after death and whether she would see her parents or my father, but then quickly dismissed her curiosity with a cheerful acceptance of her fate. On day 11, Mom became less responsive. On day 12, she peacefully slipped away. Mom taught us much at her life's end, and particularly in those last 12 days. Witnessing her grace, her humor, her wisdom, and her compassion for all whom she touched in the extraordinary circumstances of her passing was an experience that I will never forget. Seeing her take control of her death, much as she had of her life, was empowering to everyone who was with her and who heard of the circumstances of her death. I am so proud to be her daughter. I received more than 200 emails after this article was published in the Philadelphia Inquirer, and almost all of the emails expressed gratitude for information about VSED. Many were from people with cancer or other terminal illnesses who stated that they had not been aware of this option and planned to speak to their physicians about it. Many were from people who had witnessed the painful and undignified death of a friend or loved one and harbored a strong fear of having to face a similar fate, who now expressed a strong sense of relief that there was another option. A remarkable reaction came from physicians, colleagues of Elliot's, who read the article. Numerous physicians disclosed to us that they had no idea that this was a practical option at the end of life. From what I have read and heard from family members of loved ones who died using VSED, my mother's experience is similar to others who have hastened death through the use of VSED. But the process of sharing my mother's story revealed a dramatic lack of information about VSED among both the patient population and the medical community. I have read an interesting fact about VSED. Even in states where physician-assisted suicide, or what is now called medical aid in dying, is legal, VSED is chosen twice as often. And I have some ideas of why this might be true. There are no legal requirements regarding the use of VSED, in contrast to medical aid in dying. Second, it's a less, one could say, violent or more gentle way of dying than taking lethal medication. Third, the slower process with VSED permits reconciliation and healing goodbyes with loved ones. And fourth, and perhaps most importantly, is the issue of control. Death by VSED occurs over days. It's an incremental and reversible decision. In other words, the patient has control through the whole process. Control as to whether to initiate VSED, control as to when to initiate VSED, and control as to whether to continue VSED. Interestingly, it is reported that just the knowledge that VSED is an available option often gives a person a sense of control, even if they never choose to initiate it. Control exists in the knowledge that when life's burdens consistently outweigh its benefits, there is a way to exit gracefully. Many people, like my mother, are not afraid of death, but are afraid of the suffering caused by the progression of a terminal disease. There have been many advances in palliative care in recent years, but it is not a panacea. VSED allows for a more independent and potentially more meaningful death experience for the dying person and the family and friends. It is very compatible with dying at home for many reasons, but especially because it is not at all dependent on technology. Practices similar to VSED are not new. Interestingly, in Jainism, an Indian religion that dates back to the 9th century BC, there is a ritual in which the Jain practitioner stops eating and drinking to prepare for death, with the intention of purifying the body and removing all thoughts of physical things. And this practice is still used today, and Hinduism has a similar practice. And now Elliot will discuss the physiology of VSED.
Hello. So what is the definition of VSED? Voluntary stopping of eating and drinking. We call it VSED. VSED is described as an action of a competent, capacitated person who voluntarily and deliberately chooses to stop eating and drinking with the primary intention to hasten death because unacceptable suffering persists. VSED is distinct from the situation where there is a loss of appetite or thirst that is often a natural part of the dying process. The emphasis in the definition of VSED is that it is intentional. Why would a person choose VSED as an end-of-life option? When the quality of life significantly diminishes, some of us prefer to hasten death, or in other words, not prolong life. This is the same reason that many of us have signed advance directives or living wills. What amounts to a poor quality of life is a very personal decision. For one person, it might be the inability to communicate. For another person, extreme physical suffering, being a burden to loved ones, loss of independence, loss of bodily functions, lack of consciousness. But when the burdens of life consistently outweigh the benefits, some people are looking for a gentle way to exit life. Susan's mother is an excellent example of a person for whom VSED is an option that should be available. She was, up to that point, a healthy, vibrant, intelligent, active 88-year-old who was diagnosed with metastatic cancer of the jaw. She completed an arduous, painful course of chemo and radiation therapy and found that it had not worked, and there were no other options for a potential cure. She had already suffered from a steady but increasing pain that required narcotics, and it was only going to get worse. And a noticeable mass in her lower right jaw was rapidly growing, and over months or even weeks threatened to close her windpipe and make breathing and swallowing difficult. And so after meeting with her children and grandchildren, she stopped eating and drinking. The thought of dying in any situation raises questions, fears, and emotional confusion. But the idea of causing death on purpose by starvation and dehydration certainly provokes images of suffering and pain. There are many images associated with dying by starvation and dehydration, such as TV commercials of small children starving in third world countries. And we can all see the image of a person lost in the hot desert, crawling along in severe agony with skin and lips parched and cracking. These are some common images associated with dying as a result of starvation or dehydration. Many people, including physicians and professional caregivers, think that VSED would cause significant pain and suffering. It is important to note here that these images of dying invariably are about people who are in adverse situations, who do not want to die and are struggling to stay alive. There is a tremendous psychological component to their suffering. In contrast, VSED is used by people who are at the end of their life and have accepted that fact. They have voluntarily chosen to maintain control of their life and the dying process. And what clinical experience confirms is that in reality, VSED as a means of hastening death can actually allow a person to die with less pain and suffering. So now let's talk briefly about the physiology of VSED. There are two aspects to VSED: stopping all food, which causes starvation, and stopping all liquids, which causes dehydration. In VSED, death occurs as a result of dehydration. For most people, in 7 to 21 days, but usually less than 2 weeks. This depends on multiple factors, including other illnesses and the strength and state of nutrition and hydration of the individual. Of course, the detailed metabolic description of starvation and dehydration is quite complex, but I will simplify here. When we stop eating, starvation starts to occur. The body initially uses the stored sugars, mainly from the liver and kidney. These sugar stores, however, are depleted in a day or two, and the body starts to burn fat for energy. The fat is converted into free fatty acids and glycerol. The free fatty acids are converted into ketones and the glycerol is converted into sugar. Eventually, in the starving person, the body also starts to break down muscle for energy, but that does not happen for about a month and so is not relevant for VSED. A few things happen as a result of the ketosis, which develops from the metabolism of the fats. One, the ketosis, possibly in association with the release of endorphins, causes a mild euphoric peaceful state, but the person remains alert. Two, the ketosis suppresses the feeling of hunger, and this is one of the reasons that absolutely no food should be eaten. If the person eats even a little food, the ketosis could be reversed and the patient will feel hungry all over again. And three, there is a metabolic acidosis. The body becomes mildly acidic, and to compensate, the respiratory rate increases, but this is not uncomfortable. Now, simultaneously, the body is becoming increasingly dehydrated. Humans lose water continuously through respiration, perspiration, and urination. And the only way to replace the water is to drink. So when we stop drinking, we naturally get progressively more dehydrated. This results in increasing electrolyte imbalance and the accumulation of metabolic breakdown products and toxins. As the dehydration increases, there is a progressive increasing lethargy, eventually leading to coma. Organs start to shut down and fail, and ultimately death results from an arrhythmia, irregular heartbeat, or the heart stops. There are many descriptions of people using VSED to hasten their death. It is reported that VSED does not cause significant suffering or pain and can actually make the dying process more comfortable. In one study, hospice nurses reported that patients who had died using VSED showed few signs of pain and suffering, 2 out of 2 on a 10-point scale, and that the quality of their deaths was very good, 8 on a 10-point scale. VSED is a decision made by a competent person in order to gain more control over their dying. There is no permission necessary from doctors or lawyers. There are no waiting periods. There is no technology required, but support is important. The information gathered while learning about and discussing VSED affords a sense of confidence and comfort, even if a person decides never to use VSED. This serves as sort of a security blanket, just knowing that the option is there if wanted or needed. Dying is hard work, and thinking about it raises extremely emotional and complicated issues. So coming to the decision to use VSED is a process that should occur over time. It is essential that the person thinking about VSED understand their illness and all of the available options and treatments. It is very difficult to undertake VSED without help. The process begins by discussing end-of-life wishes and concerns with family, appropriate friends, physicians, caregivers, and clergy. A patient should consider writing down or videotaping thoughts and reasons for choosing this approach. It may help clarify thoughts for oneself as well as helping others to better understand the patient's reasoning and follow the patient's wishes. It is easy to understand how other people might get confused about someone wanting to starve themselves to death. And so it may be very difficult for family and friends to understand why a person has made this choice. And therefore, the person may experience a lack of support or understanding from friends and family, and even from professional healthcare providers and clergy. Many healthcare providers, physicians, and hospice workers may simply have no experience with VSED. People who are going to help a person through this process need to understand VSED, understand the reason for choosing VSED, and be in complete support. It would be quite unsettling for loved ones to start arguing and adding obstacles to the patient during the dying process. Someone who does not understand VSED might think that they are making it easier for the patient by suggesting that the patient slowly wean themselves off of food and drink, or by offering food and drink once VSED has started. This would just cause more distress by prolonging the process and possibly reversing the ketosis causing hunger. It is very important that the person meet with their physician to discuss the illness, issues, values, and wishes, and make sure that the physician understands VSED and is in support of this decision. The patient does not need the physician's permission, but a committed medical partner is extremely important. If for any reason the physician cannot support the decision, then it is necessary to ask for a referral to another physician who will support the patient in their choice. Also, a physician must be willing to make a referral to hospice care when appropriate. Finally, it is important to discuss with the hospice organization that you are hiring, that you are planning to use VSED, and make sure that they have the knowledge and willingness to support the plan appropriately. Now let's talk about some of the problems that could occur and what can be done to prevent or mitigate the distress. As you would expect, many people report thirst and hunger, although these complaints usually resolve in a day or two, and elderly people often have a decreased or absent sensation of thirst. So it's important to distinguish the sensation of thirst from having a dry mouth. The dry mouth that might persist can be alleviated with moisturizing sprays and swabs. Excellent oral care is extremely important. Lip balm should be used to prevent the cracking of lips, and oral hygiene and teeth cleaning should be continued. In addition to excellent oral care, general palliative care is essential. Physical pain associated with any underlying illnesses needs to be aggressively treated with pain medicines. Generally, these are narcotics at this point, so the involvement of a physician well-versed in pain management is essential. And of course, the hospice workers themselves are trained to evaluate and treat pain. It is also very important to review existing medications with one's own doctor to evaluate the need and value of continuing or stopping each medication. If needed, it is okay to continue useful medication with a sip of water. Additional and supportive and palliative care is also essential and should be provided by the support team, which is usually hospice, but may also include friends and family. This care, of course, needs to be individualized, but includes such things as regular turning, repositioning, skin care, bathing, bowel care, and attending to the requests of the dying person to assure their comfort. Support for the dying person is an integral part of the dying process, and arrangements for 24-hour care should be made before the person begins VSED. Hospice is usually very good in helping getting things organized and providing support, although they may not be knowledgeable about VSED. Compassion and Choices, which is another good resource, is Compassion and Choices, which is an organization extremely knowledgeable about VSED. If the patient is in a nursing home, there may be additional complications that arise from the nursing home policies regarding hydration and nutrition. Another area of potential complication in the nursing home is the use of multiple caregivers on different shifts. It is difficult to assure that all of the caregivers understand and completely support the choice of VSED. It is important that the nursing home really understands the intentions of the patient and is willing and able to support this option. If any doubt exists, it might be preferable for the patient to move back to their own or a family member's home to die. This end-of-life option requires a determined and well-informed individual with significant support in order to assure its success. The option of VSED is not for everyone. For some, choosing the date to initiate VSED that will result in death requires more self-control and determination than they possess. And for others who are not able to gather sufficient support, this option is very difficult and may not be feasible. But for people who want to die as they lived, making personal decisions regarding important questions in their lives, with consultation from trusted healthcare professionals, family, friends, and clergy, VSED is an important option to know about. And now Susan will discuss the legal and ethical issues regarding VSED. You have the rest of your?
When a person like my mother begins to consider ways of hastening her death to avoid suffering, they may have 3 or 4 legal options. 1, physician-assisted suicide, now known as medical aid in dying, where it is legally available through lethal prescription. And that includes, at the current time, Washington, Oregon, Vermont, California, Colorado, Montana, Maine, District of Columbia, Hawaii, New Jersey, and New Mexico. You will note that it does not include North Carolina, although there are people who are endeavoring to introduce and pass legislation, and that has been going on for quite a few years, unfortunately without success. The second option is the administration of large doses of opioids or sedatives as prescribed by a physician in the case of intractable pain or anxiety in order to treat the pain or anxiety, but which might have the double effect of leading to unconsciousness or hastening death. Third, patient refusal of treatment if they are dependent on life-sustaining medical treatment, such as a ventilator or artificial hydration or nutrition. And fourth is voluntary stopping of eating and drinking. Depending on the circumstances or where a person resides, they may very well be advised or informed by their physician about the first 3 choices, but probably will not be informed about choice number 4, VSED. Why is that? Well, possibly because of lack of knowledge or misperception on the part of the medical community of the biological facts underlying VSED. Possibly because of uncertainty in the medical community about the legality of VSED, or possibly because of uncertainty in the medical community about the ethics of VSED. So today I hope to address these concerns. We were unable to find any empirical studies evaluating awareness or knowledge about VSED as an option at the end of life among healthcare providers or the general public, but our anecdotal experience has indicated that both patients and providers are often unaware of this option, or that there are many misperceptions about it. In our personal experience, even hospice nurses displayed a complete lack of knowledge of the practicalities of VSED and seemed a little freaked out by my mother's choice. However, in the 13 years since my mother's death, it seems that hospice organizations are beginning to recognize that this is an area that has not been adequately understood and considered. But it remains to be seen the extent to which individual hospice organizations actively and competently support it. Now the legal analysis. I would like to go through a legal analysis of VSED. VSED is legal in all 50 states. But by that, I mean that there is not one court case or piece of legislation making it illegal. But in most jurisdictions, there is no law at all to address VSED, and this has led to legal uncertainties on behalf of medical professionals and caregivers. These perceived legal uncertainties may lead healthcare providers to undermine a patient's decision to stop eating and drinking, or even more likely, to not even inform appropriate patients that the option of VSED exists. The few relevant court cases that do exist in U.S. case law support a person's right to self-determination in choosing VSED by analogizing it to the well-established right to refuse medical treatment, or even categorizing VSED as a direct exercise of the patient's right to refuse medical treatment. And courts have consistently held that any kind of forced feeding would be a legal battery and therefore prohibited. But what about the possible concern that VSED is suicide, and that a physician might be risking criminal or civil liability for assisted suicide in informing a patient about VSED or supporting a patient who chooses VSED? Well, first of all, suicide is not a crime in any U.S. state, but more importantly, VSED is not suicide. The human body naturally loses fluids, and choosing VSED is simply electing not to interfere with this dehydration process. Assisted suicide is a crime in most states, but interestingly not in North Carolina. But if VSED is not suicide, then informing a patient about VSED or supporting a patient who has chosen VSED is not assisted suicide. Moreover, all states which recognize the crime of assisted suicide require an active step, such as providing a toxic agent, as compared to a passive act or omission. Neither honoring a patient's decision to refuse nourishment nor providing information about VSED would be the kind of active steps envisioned by these statutes. And this active versus passive distinction was endorsed by the Supreme Court in 1997. This analysis demonstrates that there is no legal basis for healthcare providers to withhold information about VSED from patients because there is no reasonable fear of legal liability on the part of a healthcare provider. What if a physician is morally opposed to VSED? A physician is not required to affirmatively assist a patient who has chosen an option to which the physician has moral objections. But a physician is ethically required to honor a patient's refusal to receive any treatment, including forced feeding. Therefore, such a physician is ethically obligated to refer such a patient to another physician who is willing to assist the patient in carrying out VSED. Failure to make such a referral would be unethical and constitute abandonment of the patient, which is a violation of medical ethics. In summary, healthcare providers' concerns about the legality or the ethics of VSED would be misplaced. They not only may, but they should honor a patient's request about VSED. And furthermore, they should educate patients about this option. Now, before we take any questions, we wanted to mention that in the past few years, there have been a lot of articles and even podcasts posted on the internet about VSED. If you Google voluntary stopping of eating and drinking, or even just VSED, you will be able to find these sources readily. Also, the website that Elliot mentioned for Compassion and Choices has very extensive and complete information about VSED. In addition, Last year, an extensive volume on the legal, ethical, and clinical issues surrounding VSED was published by international experts on this subject. And I have given the name of this resource to Carolyn and suggested that you might want to order this for your library. So now we're ready to entertain any questions that you might have. Yes?
Well, there must be a lot of ethical and practical problems associated with somebody who may not be completely competent, dementia, that sort of thing, which we haven't touched on. I wonder if you might just address that a little bit.
Yes, as we mentioned in passing at the beginning of the talk, this option is one for a competent person facing a terminal illness. Now, competence is not a black and white issue. Lack of confidence may occur over many years. And so a person doesn't have to be completely at their top performing stage of competence in order to make this choice. But if there's any question of competence, a doctor might want to assess whether this is a choice made by a competent person. And an example, do you want to tell the story or should I? Example of a situation involving this is a close friend of ours who heard about my mom's dying and had a lot of comorbidities, although none was really terminal, but she had a very painful life. And her mental competence was deteriorating. But she decided she wanted to die using VSED. She had a lovely family, but she no longer wanted to continue suffering. So, and she lived in a life care facility, so she started her fast. Well, and she had round-the-clock care. Every morning or many mornings, she would wake up and ask for food or water. And her children or a caretaker would say to her, if that's what you want, that's fine. But if you recall, you were using voluntary stopping of eating and drinking in order to hasten your death. Is that what you still want? And she readily agreed once she was reminded. So competence is variable, and it needs to be taken into account, but it's not black and white.
Also, the idea...
Oh, I turned it off.
Can you hear me? Yeah. Also, the idea of deciding when you are competent, that when you become incompetent, you would then like to use VSED as a way of ending your life once you become incompetent. So I think this is Susan's area, of course, but the legal issues around that are still fairly uncertain. But it is really a very active area of discussion because more and more people really want to have that become an option that is available. Right now, it's still legally uncertain.
But one of the issues that's being considered along those lines is whether a person can include in their advance directive when they are competent that they want to make this choice, and it's still somewhat uncertain how this would play out if it were challenged legally. And the key thing is whether it's challenged legally. If your whole support system is in agreement, it's not as much of a problem.
Okay. Me? Oh, okay. Does Duke Hospice support this?
Duke Hospice, do you want to answer that?
Well, we don't really know. I did volunteer for Duke Hospice, but it was a number of years ago. And at that point, they were kind of willing but uncertain, but I don't really know. You would definitely need to talk to your hospice provider, really, if you wanted to do that before you hired them.
Is Duke Hospice the support Crowsdale?
Yes, we have Duke Hospice, and we also do Transitions Hospice as well out of Raleigh.
So it's something that you could check with in advance with the hospice organizations. That would be useful.
Are there any instances of insurance companies refusing to pay a death benefit if someone uses this?
I didn't hear the question.
Are there instances of insurance companies refusing to pay a death benefit?
Okay, so this is a good question that we've gotten many times and we didn't have the answer to, but it's in this volume.
Would you repeat the question for
Yes.
everyone? Thank you.
The question, as I understand it, was whether using VSED could create a problem in your family collecting proceeds on a life insurance policy. Is that correct? First of all, it shouldn't, because it's not suicide. It would come under the issue would come up under the suicide provision in the life insurance policy. But those suicide provisions only apply for the first 2 years of the policy. So in most cases, it shouldn't even be an issue. If it were in the first 2 years, it's possible that the insurance company could raise it, but I think it's unlikely.
Oh, I was wondering how you respond to nursing homes and other institutions that worry about being accused of negligence by, say, family members are flying in and weren't involved in the decision, and their reticence, because that I've had some experience with that.
Well, the answer to that is really good documentation. It really goes a long way. If you have really carefully documented advance directive, your choices and reasons beforehand, it really does stand up legally to support the decision.
In addition, there's no replacement for good family communications in advance. It can cause issues if a person decides sort of precipitously to take this avenue, but if there is communication within the family, which I understand within every family is different, but if there's good communication and discussion in advance, that helps as well.
I don't recall this being an option on the advanced directive form. Is this something that could be written in when you are competent?
Yes, and there are many references in this volume to language which can be used to include this in one's advanced directive.
And that was my question. Exactly what kind of language would you need to put in to set the timing for VSED to begin if you are not competent?
I didn't hear the last, exactly what language. I think this book addresses that, but you would just have to express clearly that if I cannot be cured, and if I am in pain, I would like to stop eating and drinking to be allowed to die. Those are not the legal terms that I would use. The book
That
covers
sounds
it.
like then that you don't have to be exact and specific.
Pardon me?
You don't have to be exact and specific?
Well, the more specific you are, the better. That's why I'm referring you to a resource which gives language that's been adopted after, thoughtful consideration of what would be the most effective.
So let me just quickly say something about advanced directives. VSED, we're not talking now about people who are incapacitated. We're talking about people who are competent and able to make their own decisions. And the advanced directive really only comes into play when you are no longer able to make your own decisions. So really, you would initiate VSED and be responsible for it, and the advanced directive wouldn't be part of that. And by the time you became unconscious, it was, it would be clear that it was part of the process, and so shouldn't be challenged. What's going to happen, bringing incompetency into the advanced directive needs to be really precise and accurate and still really on uncertain terms.
The name of the title of that book you're holding up in your left hand is, please?
Voluntary Stopping of Eating and Drinking, a compassionate, widely available option for hastening death.
Thank you.
This is more of a question for Kim, I think, which is the pavilion prepared to help people with this process, and are they knowledgeable about it, that sort of thing?
That's a little sketchy in terms of my answer. I actually did have a conversation with Dr. White previous to this session. She was very curious about it. As you noted, I think some medical directors and even hospices out there are just a little bit unsure of it. But she did note that in her time here, she has had a patient who has attempted VSED, actually on 2 different occasions, the same patient, and found it very difficult, obviously, kind of came back from it. But she supported that, and I think that's the important thing is I find Dr. White to be very open and listening very well. So I feel like if it was something that was really something that the patient wanted to do, that she would be there and she would support that. And then she is very good at orchestrating and making sure that everybody else is kind of on board with it. So, I can't speak for everybody, but that was the information that I gathered.
And every situation is individual, but what kind of support a person has is key to how difficult they find it. And even having friends visit for short visits, because it can be boring. Mm-hmm. So having some distractions is very helpful as well. So the more the community can look into this option and then support it, as well as the medical staff, as well as the rest of the staff, the more likely you are to be able to use it successfully. Mm-hmm. Actually, Carol Woods does have it kind of, I don't know if I'd call it formally adopted, but they've had numerous people use it successfully.
Yeah, I believe that.
Yes. Oh, I'm sorry.
I just wanted to say my husband passed away 7 years ago with cancer. His hospice nurse, which was through UNC, and it may have been a private company, I'm not sure, but she mentioned to him at one of the earlier weeks that he could stop eating and drinking if he wished. And I'm not sure if that happened or not. I do know that he slowed down immensely on what he was putting in his mouth. I just wanted to say it was supported by that particular nurse. She didn't call it VSED, but she said you could just do it.
Now, the tricky thing there is that just cutting back on your food and drink wouldn't have the same physical effect as stopping it completely. But he may have cut back so much that it really did have that effect. But it's good to hear that the hospice nurse would pass on that information.
We got one over here.
Who determines competency?
Well, if there's a question, it's a psychiatric diagnosis if it's really under question. So you can call in physicians and psychiatrists.
Okay, well, what I'm thinking about is you get your family together and they all agree that this is something that should happen. And then they watch it happen and somebody says, well, when she made that decision, she was not competent. Then what?
Well, you could, I mean, it could be a little bit of contention there, but it is possible to get an evaluation to determine whether a person is competent, what their real reasons are, if there's anything kind of funny going on about it.
And if a doctor determines that his patient is competent for this purpose, I don't think that anyone could successfully challenge that. Especially a doctor who's the primary care physician for the person and knows them over a period of time.
Any more questions? Yes. A couple more here.
Kim, you mentioned last time if someone dies away from home or during the night in their own bed with no one around, that the law is called, and that sounds terribly intrusive to me, and I would like to have that addressed, please.
Yeah. So if there is an unexpected death, a lot of times in this community and in the other communities I've worked in, that will prompt the police and a medical examiner to come. But the way to thwart that off is because if you're on hospice, that doesn't happen. So, but if it's unexpected, if somebody is not expected to die and that something happens in their home and they're dead, then typically 911 is called and a little process takes place where a medical examiner will come. And it's up to the medical examiner whether that person may go to a funeral home or maybe to get examined for cause of death. And I can throw that to you.
That's correct. I mean, basically, a person who is using VSED is under hospice care, and so when the person dies, the hospice team will sign the death certificate, and that makes it legal.
Another question is, can you place this in context with withholding other kinds of treatment, such as withholding dialysis, or that's life-saving, withholding insulin? Is it the same? Are they the same legal arguments?
Yes. I mean, the argument is very much the same, that a person has a right to refuse treatment, and eating food and drinking water are considered in the same vein, the same kind of decision. And they can't be forced legally to accept any kind of treatment or accept food and water. They can't be force-fed. So it's the same reasoning.
Okay. Any more questions? Going once, going twice. This has been an amazing program. I really appreciate you coming. I feel like I've learned a lot today, and I hope everybody else has learned a lot. We have one more session to go next week. I really appreciate all your attendance. Appreciate our wonderful speakers out here. Thank you very much.
Thank you for having us.
Thank you.